Hi, my name is Jennifer Rourke. I am a mother, an advocate, a member of the Womxn Project, and a candidate for the Rhode Island State Senate. I have spent my life making sure that no one is left behind and fighting for positive change. But right now, as we face a global health crisis, I can't help but to think about what this will mean for people who are pregnant. Black and brown women face a much higher rate of death as a result of pregnancy and childbirth. Research has shown that Black and brown women are 4 times more likely to die from pregnancy-related causes. Racial disparities exist even when socioeconomic status is accounted for. Despite decades of medical advancements, maternal and infant death, illness, and injury persist at alarming rates, particularly in low-income and Black and brown communities. This has been made worse now that we're in the midst of a pandemic. With many people losing their jobs and struggling to make ends meet, prenatal care made more difficult to get to due to stay-at-home orders and fears related to transmission of the virus, and the fact that some people are being told that they can't have a partner or birth worker with them when they are in labor, we are truly in a maternal health crisis. Birthing people are not only at risk of contracting COVID-19, but are also at risk of experiencing harms caused by the secondary effects of the virus, including the slow and inadequate response of the government and the resulting in the hospitals being overwhelmed. We really need to think outside the system to protect those receiving care. Birth workers, especially those who practice in-home and birthing centers, have not historically been included in emergency planning, and that needs to change to best protect pregnant and birthing people. Hospitals should accommodate laboring people having at least one support person with them during their hospital care. Supporters can be required to help mitigate risk of transmission. Hospitals and birth centers may also look at ensuring that the use of telehealth for virtual doula support as a strong addition to support systems. We should make sure people are informed and supported to make decisions about their birthing experience, not coerced or pressured. As states look to continue to develop their emergency response, they need to value and consider the needs of pregnant and birthing people. We also need to look at access to hospital alternatives, including supporting home birth and eliminating barriers, including onerous licensing requirements that can take away access to midwives and doulas and other birth workers who are so important. Midwives and doulas are essential workers. We should ensure that they are exempted from stay-at-home orders and they have the ability to travel and access to emergency equipment, including, but not limited to, PPE. Hospitals need to have protocols to accept transfers from homes to medical facilities during this pandemic and require best practices for interprofessional collaboration. Insurance companies should also accommodate needed changes in provider and facilities as a result of this pandemic. We need to look at how to expand Medicaid and make sure that undocumented women are not denied access to the full range of care they need to give birth and heal postpartum. We should not separate babies from parents at birth, except as a last resort when the infant needs care, and make sure that support for nursing and postpartum care continues to be available. Of course, we need to look at how we can support the well-being of families with paid family and medical leave, nutrition assistance, and affordable housing, and making sure that we can all make a living wage and have access to unemployment benefits and a true safety net. These are just some of the steps that we can take to support the health of pregnant people, their children, our families, and our communities. We also need to make sure that when guidelines are created around this pandemic, when programs are developed to ensure access to health care, and when community-based responses are designed to meet the needs of our families, that we include people who work with pregnant and birthing people and make a commitment to centering the unique lived experiences of Black and brown women, low-income families, and other marginalized people. We need to work towards the health and liberation of our bodies, our families, and our communities, ensuring that as people build or add to their families, that they can do so with health and dignity and as a critical first step. I thank you for listening.